The first trimester of pregnancy is a vulnerable period for fetal conditions, therefore you have to take care of your health and that of your fetus as best you can. Some of the exercises that you should avoid during the first trimester of pregnancy are 1. Contact sports such as soccer, football, basketball, volleyball, boxing, rugby, and ice hockey. These sports can increase the risk of being hit or falling, which can harm you or your baby. 2. High-impact sports such as horse riding, rock climbing, downhill skiing, inline skating, gymnastics, and diving. These sports can also increase the risk of falling or injuring yourself or your baby. 3. Scuba diving. This can put your baby at risk of decompression sickness and gas embolism, gas bubbles in the bloodstream, which can be fatal. 4. Exercise in hot or humid weather. This can cause you to overheat, which can be dangerous for you and your baby. You should also avoid hot yoga or any exercise that makes you sweat excessively. 5. Lying flat on your back for long periods. This can reduce the blood flow to your heart and your baby, especially after 16 weeks of pregnancy. You should avoid any exercises that involve lying on your back, such as full sit-ups, crunches, or some yoga poses. 6. Any ab exercises that cause coning or doming of the midsection. This is when your abdominal muscles bulge outwards during an exercise, which can indicate a separation of the abdominal wall, diastasis recti. You should avoid any exercises that place extreme pressure on your abdominal wall and pelvic floor, such as bearing down or planking. 7. Exercises where you hold your breath. This can reduce the oxygen supply to you and your baby, which can be harmful. You should breathe normally during any exercise and avoid any movements that require you to hold your breath.